Hello, yes.
Okay. So welcome everyone to today's networking event. I will take a second to introduce ourselves, introduce our organization, and the event that we're having here today. So, first off, good evening, everyone. Thank you for joining us today. It's an honor to welcome you to this HPHTO webinar. So, for those of you who don't know, HPHTO stands for Help People Help Themselves Organization. It's an international non-profit organization dedicated to advancing public health through innovation and community empowerment. So we operate across countries like Sudan, India, Pakistan, Nepal, Nigeria, and many more. And we address unique healthcare challenges through local leadership and tailored solutions. Our mission is clear. We want to empower individuals and communities to take charge of their health and foster a ripple effect that strengthens communities and transforms nations. Through educational programs, resource mobilization, and collaborative initiatives, we want to make strides towards global health equity. Today, we'll delve into discussions that reflect our commitment to health empowerment. Whether you're a researcher, health enthusiast, or just a student, we aim to inform and inspire. Let's embark on this journey together. Coming to today's networking event, we're very excited to have you here for this special networking event. It provides you with a unique opportunity to connect, collaborate, and spark meaningful conversations with individuals who share a common passion for global health, innovation, and community empowerment. Whether you're here to exchange ideas, explore new partnerships, or simply get inspired, let's make the most of our time together. So, coming to today's agenda, we are going to first start off with a brief overview of the theme and objectives. So, for today's session, we hope to network. We have a bunch of esteemed keynote speakers who have joined us here today. We will have fun polls, breakout sessions, panel discussions, and interactive networking, collaborative opportunities, and lightning talks. So let's start with the first keynote speaker, who we're very grateful to have with us today. Let me introduce Dr. Yaqub. So, here's a small intro for Dr. Rehan Yaqub. He is an MRCEM certified emergency medicine specialist with extensive expertise in AI-driven healthcare research, clinical innovation, and medical education. He has trained over 100 professionals in AI applications for diagnostics and predictive modeling and scientific publishing. With a strong background in patient safety, telemedicine, and digital health, Dr. Yaqub is at the forefront of integrating technology into modern healthcare. Today, he'll be talking about the use of AI in scientific research, education, and public health. We're so grateful to have you here with us today. I will give the floor to Dr. Yaqub. Thank you.
Thank you very much, and good evening. Highly grateful to this platform for giving me the opportunity to address today. Is my voice audible to everyone?
Yeah.
Okay. Let's begin with our discussion. I will be focusing more on artificial intelligence as a general aspect in healthcare, with specific focus to public health and healthcare equity. Okay, I'm with you. My name is Dr. Rehan Yaqub. I'm RCM certified UK training. And apart from that, I have done my FPS residency from Pakistan. Um, I am a lifelong learner, like all of you, like all of the doctors, or all of the healthcare professionals are there. Apart from that, I have a specific interest in artificial intelligence, integration, scientific research, and healthcare applications. This is my main theme, or my main aim is that I I have a passion to transform healthcare through AI innovation. Just a brief disclaimer, I don't have any financial affiliations with the organization who are conducting this talk or any of the AI applications which will be briefly demonstrated during this workshop. Some housekeeping ground rules: use chat to answer the questions, keep your mic muted at all times, use virtual hand to answer the questions. Preferably, it's better to take on the questions at the end of the session. Then no side chat, please, and participate actively. Coming on to the learning objectives, I'll start with a brief introduction to what is artificial intelligence, what are its types, what is the need for AI in healthcare, what specific roles AI has in patient care, doctor-patient relationship, what role AI can play in public health, though it's an evolving field and AI is evolving at a super speed, more than a capability of a human brain, I can say. Then how we can use AI to leverage health equity. And apart from that, we'll briefly discuss what are the ethical considerations while taking AI models into our healthcare, jobs, patient education, scientific research, and all this stuff. Okay, I'll begin with the quote of the day. This was by John Maxwell. The change is inevitable while growth is optional. Now, it depends on you whether you want to grow or not, but the change is inevitable. Taking into perspective, 2023, ChatGPT came, the large language models started to evolve. In 2 years, how far they have come. And I don't think so. It is going to stop here. It will integrate more and more actively in our daily life as well as our professional life. So the need of ours to learn it, but to apply it more critically, more professionally, rather than the hype that was going on in the last few months, these Ghibli images, all this crap stuff. You must have to avoid it and think critically, behave professionally, and adopt it scientifically, evidence-based, and with a strict ethical framework, I can say. Okay, I'll begin with this short story. This is a female doctor. An image in front of you is of a female doctor. His name is Aisha, and she is an internee who has just started his professional career. At the middle of the night, she is in the ER room. The ER room is very quiet. It is her first solo night, you can say. All she can hear is just the chirping voices of the staff nurses and other healthcare professionals around him. It was not a busy night there. Suddenly, a patient came, young patient, 40 years of age, with a sudden chest pain that started at night. She started to think that it may be a chest pain, but she is still very confused about it. Taking into the perspective in the third world countries, to one of which I belong as well, it's very difficult for us to keep the consultants awake at the night time. And even if we call, we will have to face their aggression as well. So she tries to call, but apart from her knowledge, it came to know that there was an AI-based algorithm discussion a few days back, and it was integrated into their healthcare system, though it was not being adopted very frankly. And she has also listened from some of her colleagues. She went there, she collaborated with that AI model. She put that all the complaints of the patient, integrated the lab results, and here she came up with some provisional diagnosis. She started the initial management of the patient, stabilized the patient, thinking of that it may be either a MI or pulmonary embolism, aortic dissection. She further manipulates the result and come to the conclusion that it may be a case of an aortic dissection. Once she has that, with all the cognitive data being backed by that AI algorithm, now she calls the consultant and tells the report that she has a patient and she's very much sure that it may be a case of an aortic dissection or somewhat else as well. but she wants to do a CTPA, and she wants the collaboration of the consultant at that time. The consultant, by taking that, she has a brief overview of the patient, but it was very well constructed and elaborative as well. So he orders to do a CTPA, and strangely, the patient came up correctly to be a case of an aortic dissection. The consultant came. He was very happy, admires Aisha that at such a young age, she came to a conclusive diagnosis, and ultimately what comes, the patient is happy, the whole healthcare team is happy, everyone is happy. So this is just a brief analogy how AI can shape. This is a brief story. Now, diving deeper, what is artificial intelligence? So artificial intelligence, basically, these are machines, or these are basically the systems that are capable of performing tasks that specifically require a human intelligence. These may be learning models, these may be reasoning models, this may be problem solving. So, what are the types of the AI? I'll briefly discuss. We have three types of AI. One is narrow AI, generative AI, and super AI. One thing I want to tell you that AI has been evolving since 1956. It was first discussed. Then came 1997. IBM made the first AI-based model, but it was basically to play a chess game. Being involved over 20 years, suddenly we came up with some large language models. ChatGPT was the first of it. Then a range of models they came. But AI was slowly being integrated from that time, 1956, to our daily life. Narrow AI is basically a small task, narrow task, such as the facial recognition, such as your Siri and Alexa in your mobile phone. Then comes generative AI. Generative AI is basically a broad term that it's basically these are the systems capable of doing this at the same capability, learning, reasoning, writing, problem solving as of the human brain. And it was based on deep learning networks, neural networks. I'll not go into more details because I myself is not a computer programmer or an expert of this, but just to briefly elaborate. Examples of generative AI we have ChatGPT, we have other LLMs like Claude, we have image generation models, we have complex algorithms. And then there is a lot of conceptual and theoretical model that is super AI, and which claims that AI will surpass human thinking. And yet we are in some researchers, they say that we are very close to achieving this point, but still we lack something over it. Now, generative AI is all your text files, coping with your audio, visual capacity, image generation or image input into this central square that is an algorithm. It is an algorithm, or you can say an effective prompt that you give. Just to take an example, that I have an MRI brain, and then I take a picture of it, or I even now the generative AI models, they support a lot of files, PDF, JPG, web files. So I incorporate into my ChatGPT and I ask for its analysis. So in this way, the text file can be in the form of a lab report, audio visual can be in the form of a patient communication, image in the form of a MRI, CT scan, mammographic scan, and then algorithmic level are the specific prompts. So whole of this generative AI or machine learning, or you can say deep learning model, it's based on three things: automation, learning, and prediction. And I think prediction is the most important thing. But the way they are operating is like same way as the human. Suppose in our childhood, we used to learn things by recognizing, by being trained. Same way, these AI models are being trained. Suppose a question is being asked, is it a cat or a dog? We embed a picture and then train it. So this is a cat, this is a dog. The same way as human brain has been developed, our neural networks, these generative AI models are based on this. And on the basis of this, new content has been generated, new content being generated, and then you can reason it with it. So there is a rising trend of the global adoption of AI. With the AI job market, they are slightly overwhelmed by the adoption of artificial intelligence, and healthcare is of no exception to it. Healthcare is growing at a rapid pace. This is a graphical representation of AI healthcare market in numbers. As predicted by one of the leading software manufacturing companies, their CEO, he claims that apart of all the AI applications they made, healthcare is the one they have to invest a lot, because ultimately we have to deal with the human outcome. Okay. So in 2022, the global market, specifically we are concerning about US market, was approximately $4.9 billion, whereas in 2024, it raised to approximately 45% of the investment that has been made into digital health was in the growth of AI in healthcare. And it's predicted to approximately range to $150 billion in 2026. So why there is the need for help for an AI algorithmic based model or an AI deep learning model to specifically integrated with healthcare workforce to deal with healthcare? The first reason, which I think is the most important, is with the advent of healthcare management information system, electronic health records, we have a lot of data which was earlier not properly handled as compared to it is now. Then another thing is we are facing continuously healthcare workforce shortage. We have a lot global data of healthcare shortage, whether it is a third world country or it is a first world country, high income countries like USA, Canada, or any other place. Supposedly, to give an example, that the US is predicted to have a shortage of approximately 87,000 primary care physicians by 2037. Secondly, I already said that data overload, the exponential growth of electronic health records, it surpasses human capabilities. And then we have to enhance efficiency, safety. When we are incorporating AI in other fields, in engineering, in writing-based industry, in scientific research. So what the aim of artificial intelligence integration in healthcare is, if you say it is an idea, the idea takes to research, but the research further goes to project, and then this project is integrated into healthcare system for the benefit of the patient. So AI basically improves operational efficiency and patient safety by automating routine tasks. Suppose the micro task, note taking of your clinical documentation, then triage time, it can be reduced by use of a specific set of LLMs if you develop it with symptoms, accurate precision, with precision accuracy can be defined with the help of an AI model. So ultimately, all of this prospect will going on to automate the task, will provide a decision support, and ultimately it will lead to reduce cost on the healthcare system. Okay, this is a graphical representation of the widening gap which is between the healthcare data growth and human processing capabilities. See, this is like beyond the limit of a human brain. The upper curve, which is showing the healthcare data grown, it is approximately around 2,000 exabytes, whereas the human brain has approximately capability of around 100 to 150 exabytes. So without these automations, these healthcare data cannot be properly incorporated. This electronic health records now, talking of my country, Pakistan, India, Bangladesh, all they are incorporating. Specifically talking about the Southeast Asia, India is the leading one to incorporate artificial intelligence in healthcare, followed by Bangladesh, Sri Lanka, and Pakistan as well. Now, what specific goals we can achieve with AI? First, to discuss what the AI has an impact on a patient care. AI can go beyond limits, starting from triaging, I said, to symptom assessment, accurate precision of the diagnosis, then specifically tailoring to the needs of the patient, managing treatment plans, providing exact guideline-based, evidence-based management, adhering patients to the treatment, providing patients with effective health education models, not only in the case of in the form of leaflets, but automating it with certain chatbots in the form of audio visual representation, and so it basically builds confidence. Before the advent of the AI era, there are problems on the physician side. They have to perform administrative tasks. They have to do micro tasks. So the attention and the time which they are giving to the patients are not satisfied with that. With the advent of AI, it can manage properly. One of the concerns is that that was a long debate over the years. Currently, also that these AI models are not, they don't have an empathic, but yet it can be trained on human empathic model again and again. Though it is not perfect 100%, but still we can automate it. We can specifically predict it, and then we can design such models. Okay. So, what the role AI can play? It improves patient outcome, precision medicine, personalized treatment, significantly improving effectiveness, treatment effectiveness for certain diseases like cancer, diabetes, cardiovascular risk factors. A lot of research has been done. I came across one model that was being developed by a doctor in US, NeuroCare AI, and they have studies in evidence that it can predict intracranial hemorrhage with the precision of approximately 96%. Apart from that, AI-powered mammography, radiographic tools have been developed to increase breast cancer detection accuracy to approximately 95%. Then AI powered clinical recommendations lead to improved patient management. It reduces the hospital admission rate. It reduces the burden on the patient. Then, apart from that, certain other aspects, if we can see, for an AI model to be effective in a patient outcome, we have to come across, we have to clearly articulate what the problem has to solve. We have to define a target group. What will be the benefit of our intervention? Is it relevant? We have to add value to it in the form of a data. We have to quantify that data, that our assumptions or our recommendations are basically based on that
And then he was
data.
like,
Then we will also have a data security, and then on basis of this, we can plan our further results. Okay, this is a diagrammatic representation of an AI-enabled diagnostic and treatment pathway. Suppose we are taking a mammography as an AI tool. It can help in patient screening. The AI mammographic tool then can provide specific outcome on the basis of analysis and detection. In some research, it says 95%. Even in some research, it was more than 95%. So if early diagnosis are confirmed, more personalized treatment plan, improve patient outcomes. Another aspect in the role of artificial intelligence in patient care is enhancing doctor-patient relationship. AI can streamline doctor-patient communication. How it can streamline the time which a physician spends on note-taking, it can be minimized. It is just an audio-visual representation, and it can be recorded. There is an AI model which is trained on the human set of data to or a multilingual set of data that they are talking in Urdu or Hindi or any other language, and it is incorporating into English. From that, you can precisely take notes. It can provide you predictive analysis of what will be the differential diagnosis. It can also predict what can be the effect, the most relevant labs. Now, this is on the basis of a doctor to integrate critically rather than to blindly follow, but it can improve doctor-patient communication. Secondly, on the way of discharge, you can, apart from giving some leaflets, you can give some specific advice. A chatbot has been developed. A specific uh, interaction can be made by the patient in the form of audio-visual uh, presentation, or the language can be simplified by an AI chatbot. It improves impact workflow efficiency by taking physicians from note-taking tasks, from nurses from these note-taking tasks, administrative tasks of the physician. Time is reduced. Ultimately, what lead to it, it reduces the physician burnout. So one of the healthcare group, that is MedSite AI, they recently presented in one study that their model, which was based on multilingual detection of the patient interaction, it can improve the patient workflow. It reduces the burnout of the patient, of the physicians, and also it improves the workflow efficiency. So this was they proposed that 70% of the physician time was cut, 50% increase in patient throughput. So once the physician time is low, you can go on a high, you can see more patient as well. So ultimately, what they did, they say that on the basis of that, approximately 8 additional patients can be encountered by the physician, and by taking off these micro tasks, like uh, the the thought process of a physician on a certain specific patient, it is improved, and it is more efficiently handled as compared to the, if he has to do everything, to order investigations, or to take the notes, he has to be involved in administrative tasks, speak at the conferences, etc. Now, apart from that, data management in clinical trials can be efficiently handled with AI. This is one of the aspects where equity can be of benefit. Data management in clinical trials can go beyond the specific certain cultural or ethnic group. Some underserved areas which were not previously enrolled, the clinical trials can enroll based on certain selection criteria. It can make predictive analysis through clinical trial site selection, reducing enrollment time by approximately 15%. Real-time AI analytics facilitate immediate clinical decision making and improve patient safety. Now, coming on to specific artificial intelligence and public health. It has a lot more roles in public health. AI has revolutionized the public health, starting from the first the vaccination model was taken into consideration. So, what AI can do in public health, it can improve disease surveillance, it can predict outbreak prediction based on some certain specific criteria. Suppose if there is a search of flu treatment from a certain specific area. So it can predict beforehand that an outbreak is going to be erupted in that specific uh, geographical area, or in some specific ethnic group. Then predictive analysis, it can predict beforehand, so proper resource allocation can be done. Uh, More and enhanced public health campaigns, and ultimately education can be done. It was not possible before the pre-COVID area, where we are not taking technology into hand. Health education can be done. Virtual meetings have increased, and then AI has poured its role into it. AI created chatbots, AI created algorithms, and predictive analysis has revolutionized public health. Then real-time data analysis aids in effective decision making, uh, tailored to the patient needs, tailored to that specific age group, and Secondly, adhering that patient to their treatment. Advanced algorithms identify health trends and risks early. Then comes the AI-driven behavioral change. AI-driven behavioral changes, like just see all of us are using smartwatches. So these smartwatch, they can predict our lifestyle. They can predict our healthy habits of walking, eating. All data can be incorporated. Then smart tools having developed. Suppose tool has been developed and incorporated in the smartwatch that reminds the patient of their medication. So whether there is a diabetic patient and he routinely forgets his medication, not compliant fully with the treatment, but specific signal can be sent by an AI chatbot incorporated into the cell phone or smartwatch or a tablet, so he can better adhere to the treatment. So what it ultimately done, it changes the behavior. Apart from that, health education is another other thing that can be incorporated into this. So AI powered chatbots and virtual assistants for health coaching and support, then personalized health recommendation, increase adherence to health behaviors by 30%, and popularity of AI-powered mobile health apps and wearables is projected to reach over 45% adoption among adults by 2026. So this is suppose the data is collected by this can you can say as well. Data has been collected as in a patient who is using a cell phone or smartwatch coming to the clinic of a cardiologist, and on discharge he gives that specific instruction, and apart from that he asks him to add that chatbot into the smartwatch. What it does, apart from the usual routine, it takes into account his heart rate and other parameters as well. It collects the data, analyzes once the patient has some problem. It gives personalized health recommendations. It can connect immediately. Pop-up can be to that specific healthcare physician or the specific hospital where he was enrolled. So, taking all to it, it leads to behavioral change of the patients as well, and it increases the compliance and adherence to treatment. Then comes the AI scientific research. A lot has to be talked about AI and scientific research, but artificial intelligence can integrate in each and every level. Now, it's our duty to use it ethically. Some of the golden rules which we can use while incorporating artificial intelligence in scientific research is that first is that use artificial intelligence to structure rather than to copy the content. There's a growing trend nowadays to copy the content. You can copy the content for LinkedIn posts or social media posts, but not for scientific purposes. But definitely, if you have some idea and you interact with the large language models and they give some idea, it gives us you a starting point from where to start, rather than to just blindly follow the content. At least you can follow the structure and you can come up to a conclusion. Then second one is that use artificial intelligence tool. You outsource your academic labor to AI, but not the critical thinking. The critical thinking has to be maintained, and it has to be basically used to train the AI models. It has to be incorporated along with artificial intelligence. Then use artificial intelligence as your academic peer, or you can say your research assistant rather than your supervisor. There's a lot of things. There's always a debate. There are two skeptical group of people. One thing that you should do all of the work. You can handle it to AI. Bill Gates recently spoke that within 10 years it will take healthcare jobs as well, but this is not going to happen. What I predict from it. You use and other group is that Other group, they say that AI is a very horrible thing, or it is sin not to use it. So both groups are actually not right. Don't over rely on AI apps, but use your common sense as well. And this is also one of the rules to use it in scientific research. So, integrating AI in healthcare research is not just speeding up the process, it's about achieving more accurate, reliable results that can transform patient outcomes. Okay. So, we'll move. So, AI can help in each and every step of writing and publishing a scientific manuscript. Starting from brainstorming research ideas, research questions, your large language models can do very nice job. There's an brainstorming research question tool made by Elicit Consensus. You can also use an AI-powered chatbot that has been developed by Mushtaq Bilal, the research kick. Then for literature search, reading articles, extracting data from them, SciSpace, Consensus, Elicit, all these AI models can be used. Creating questionnaire, you'll Google Forms, data collection tools, then data collection, even data analysis. Julius AI is one of the apps that can be used for data analysis. Then manuscript writing, your language check, grammar, syntax, referencing in citations, and formatting. Not to copy the content, but to follow the structure, to analyze it grammatically, adding reference and citations, taking help in formatting, and then journal selection as well. So coming on to the AI for healthcare equity, AI can be a source to maintain equity rather than equality. So there's a brief difference between equity. Equity is when you equip according to the specific needs of that people or healthcare group, rather than to equally distribute the the resources. So AI can be used. One example of this equity use is what we use artificial intelligence in telemedicine and telehealthcare. Telemedicine started long ago, but it evolved during the COVID time. Then it started to now it from telemedicine it becomes telehealthcare. You incorporate health education in that, uh, based on certain cultural, ethnic disparities, social factors. You can address to specific needs of the people. So AI can be a source to maintain basically health equity. Then a lot of things can be done. AI can improve healthcare access in underserved areas, telemedicine, develop culturally sensitive and personalized health intervention. It can provide AI-powered tools for language translation and communication. It reduces bias in healthcare algorithms. Always the bias can be there. It can be an accessibility bias. Suppose a chatbot has been made, it is not accessible by a certain group of people, a certain geographic area, or adoption bias, certain cultural, ethnic, societal factors are there that hinders them from adoption. So the bias is always there, but now it's our responsibility to how to integrate it more scientifically, more evidence based. Equitable access to healthcare enabled by AI. All there's an enormous growth of the use of the cell phones. These chatbots can be incorporated into it. Suppose an MI patient being enrolled in some tertiary care hospital has, just give an example, he is using some device or wearables or even by symptom outcome or symptom precision, he can reach that specialist, which was not possible before this AI era. One other example of use of artificial intelligence tool is tool has been made in a wearable device basically, to predict the risk of supraventricular tachycardia by calculating the heart rate. So once it pops up, it beeps, it encourages the patient to himself do the vagal maneuver. Then ethics is a long debate on ethics. There are a lot of ethical concerns, specifically to data privacy and security of the data. Now, adherence to all these data privacy and security must be according to the HIPAA guidelines, and the who whoever developing the chatbot or integrating artificial intelligence in healthcare must take responsibility as well. There must be transparency and explainability. Most of the AI models, they behave like they behave just like a black box. They are adopted for their accessibility to certain groups, and they have some difficulty in use. So these concerns must be raised and must be addressed. There must be proper regulatory framework regarding applicability of artificial intelligence in healthcare and public health. Then comes patient autonomy and informed consent in the age of AI. Relying too much on AI apps for predictive diagnosis, for management of the patient, can sometimes obscure a patient autonomy. However, if we follow strict ethical guidelines, patient autonomy must not be compromised, and informed decision. Patient must have a right to form informed decisions, even in the age of AI, by incorporating to uh, more human-based interaction. So, just a brief recap: AI can involve all of the phases of patient and healthcare management, both on individual level and public health level. So this question has already been asked, will AI replace doctors? So what I think, AI will not replace doctors, but those physicians who use AI or who learn how to use AI will definitely going to replace those who are very skeptical or very against the use of the artificial intelligence in healthcare integration. So AI will not replace physicians. However, physicians who use AI will replace those who don't. So the house is open for questions. I hope I have briefly explained each and every aspect. If you have any questions, you can ask now.
Thank you so much for your wonderful presentation, Dr. Rehan. Any questions will be taken during the panel discussion.
Okay.
If it's okay, we will now hand over the floor to the next speaker.
Okay. Thank you very much. You can hand over
Okay.
the floor to the next speaker.
Yeah. So coming to our second speaker, let me take a moment to introduce our second keynote speaker for today, Konstantinos Eftimikos, who is a PhD researcher and head of cancer and IT applications at CPRG Greece, who is bringing groundbreaking insights at the intersection of oncology and artificial intelligence. So today, he'll be talking about AI diagnostics and malignancies found focusing on breast cancer. So I will hand over the floor to Mr. Thank you so much.
Good evening to everyone, and thank you for giving me the opportunity to speak with you today. I will keep my speech brief as possible because I'm currently in Vienna attending the Congress of the European Society of Clinical Microbiology and Infectious Disease as a truly exciting event where we are seeing how science and technology are shaping the future of healthcare across disciplines. But I didn't want to miss the chance to talk about something equally transformative, the role of artificial intelligence in cancer diagnosis, especially in breast cancer. We are studying at the intersection of medicine and machine learning, a point in history where the diagnosis of malignancies is being transformed by artificial intelligence, the AI. Among the many types of cancer, breast cancer has become a focal point for the application of AI technologies due to its relevance and the critical importance of early detection. Breast cancer is the most common diagnosed cancer among women globally. Despite significant advances in screening, many challenges remain: radiology shortages, high volumes of mammograms, and risk of human error. This is where AI steps in, not to replace clinicians, doctor, medicines, medical technicians, etc., but to empower them with tools that enhance precision, reduce fatigue, and ultimately save lives. AI, particularly through machine learning and deep learning algorithms can be trained to recognize patterns in medical images, such as mammograms, MRIs, and ultrasounds. These algorithms learn from thousands, sometimes millions of examples, identifying some changes or early signs of malignancy that may not be immediately obvious to the human eye. Studies have shown that the AI system can match or even exceed the diagnostic accuracy of expert radiologists, taking breast cancer in certain scenarios. One powerful example is the use of convolutional neural networks, (CNNs), which have shown impressive performance in classifying breast lesions. A 2020 study published in Nature found that a deep learning system trained on over 76,000 mammograms outperformed the group of radiologists in identifying breast cancer, both in sensitivity and specificity. What's more, it reduced false positives, a common cause of anxiety and unnecessary biopsies, with very huge cost. But AI's contribution goes beyond imaging. In pathology, AI is being used to analyze biopsy slides, looking for cancer cells, and creating tumors with high consistency. In genomics, AI helps interpret complex genetic data, offering insight into a patient's risk profile and guiding personalized treatment plans. Let's not forget another vital aspect: speed. AI can process thousands of images in the time it takes a human to review just a few. In healthcare systems trained by workbook sources, AI acts as a force multiplier, helping radiologists prioritize cases, detect high-risk lesions earlier, and improve workflow efficiency. Still, we must remain cautious. AI is not infallible. It can be biased if trained on non-representative data. It can be, sometimes called the black box problem, where we don't fully understand how a model reads a decision. And in life or death context, like cancer diagnosis, trust, transparency are non-negotiable. That's why AI should be seen as an assistant, not a replacement. The best results come from collaboration. Radiologists interpreting AI outputs with clinical judgments, and AI tools continuously learning from new data under strict ethical and regulatory frameworks. Another consideration is accessibility. The promise of AI in cancer diagnosis must not be limited to high resource settings. Its greatest impact may be in underserved areas where access to trained specialists is scarce. Imagine a real clinic with limited radiology expertise, but equipped with an AI tool trained on millions of cases. That tool could offer a second opinion in real time, potentially changing a patient's life trajectory. Looking ahead, the integration of AI into routine clinical practice will require more than just technology. We need cross-discipline, multi-clinician, data scientists, nursing, and ethicists. We need robust validation studies, regulatory oversight, and a commitment to equity. And most of all, we need to involve patients, earning their trust by explaining how the systems work and how their data is being used. conclusion, artificial intelligence is not just a buzzword. It's a transformative force in the diagnosis of malignancies. Especially in breast cancer, AI has shown its potential to enhance early detection, reduce diagnostic errors, and optimize patient care. It's not the future. It's already here, and it's up to us to shape its responsible, ethical, and inclusive use in medicine. Thank you all very much for your attention.
Am I audible? Okay. Thank you so much, sir, for this enlightening session. I will now take the time to hand over this session to Dr. Razan, the founder and chairperson of Help People Help Themselves organization.
Thank you so much, Deepika. Am I audible?
Yeah.
Okay. Good afternoon, everyone. My name is Razan Osman, the founder and chairperson of HPHCO, and I'm honored to moderate this panel with such esteemed guests. Thank you for joining us today for what promises to be an insightful and engaging discussion on the role of AI in healthcare. Today, we're going to be using an app called Slido to allow everyone to be able to participate. So throughout the discussion, if there's any questions that we'd like everyone to get involved in, something is going to pop up on your screen, allowing you to be more engaged. Today, we hope to explore not only the advancements that AI has brought to healthcare, but we also want to address the potential of some of the most pressing issues in healthcare. Equity, access, and equality in our healthcare systems. First of all, I would like to reintroduce our panels list. We're honored to be joined by 3 distinguished experts today. First of all, we have Dr. Rehan Yaqub, who has given us a very informative session before. He is an MRCEM certified emergency medicine specialist with extensive expertise in AI-driven healthcare research, clinical innovation, and medical education. We're also joined by Mr. Mohammed Al-Sayed, who's the head of digital health transformations and training and research at the Nasser City Center, Cancer Center, with a great interest in public health and clinical pharmacy. We're also joined by Mr. Michael Alwyn, who is the CEO of Instacart and a visionary in the health tech field. Mr. Michael is working tirelessly to bring AI-based solutions to healthcare, essentially focusing on making healthcare more accessible through telemedicine and AI-driven platforms. Before we start, I would like to give the floor to each of our panelists to introduce themselves and share a bit about their work that will help us understand their unique perspectives and their expertise. We can start with Dr. Yaqub, if you may. Am I audible? All right. How about Mr. Mohammed Al-Sayed? Would you like to introduce yourself?
Okay, thank you for your invitation to join this panelist discussion. My name is Dr. Mohammed Said Abdelaziz, Head of Digital Transformation and Healthcare Systems at Nasser City Cancer Center, Egypt. Clinical pharmacy by education and health informatics by training, public health. We want to this is my bio. Let's discuss or after the panelist background introduction.
Yes, thank you so much for introducing yourself, Dr. Mohammed Sayed. We'll do a small introduction for all of the panelists, and then we will start discussion.
Okay.
Mr. Michael Alwyn, would you like to introduce yourself, please?
Sure. Thank you. Thank you for giving me this opportunity today. So myself, Michael Alwyn. I'm the co-founder and CEO of InstaPract. So I hold 17 years experience running different tech-driven companies, ODC centers for customers back in the US and in different part of the world. InstaPract is our health tech company, which we have co-founded along with my other co-founder in UAE. We are in business for last 6 years at this point of time, working with large hospital groups and ministries in the region. And our core solution is telehealth, and we are also working on every digital health experience which touches the patient's engagement and experience around it. So that's where we operate at this point of time. Thank you for this opportunity.
Thank you so much for the introduction. As Dr. Yaqub has already introduced himself, maybe he would like to add more. If so, we would be grateful to hear that too.
Okay. Thank you very much for inviting me to this platform. As I already introduced, I am a clinician, basically emergency physician, and later on I have some fellowship in public health and community medicine from Pakistan. My expertise basically lies in simplifying artificial intelligence tools for scientific research. I have trained almost more than 100 professionals on the use of AI tools, specifically harnessing the use of large language models in scientific research, AI-powered literature search, how AI can simplify the job of a medical student, the work of a medical student, basically, or the studies of a medical student. Apart from that, I am a medical educationist as well, and basically tries to incorporate artificial intelligence, but maintaining the critical insight in my medical education journey as well. This is a brief overview regarding me. So thank you once again.
Thank you so much for the introduction. I'd just like to add that your session was very informative, and it really struck so much inspiration, especially when you emphasize the fact that AI is not here basically to replace us, but to enhance our role as healthcare workers, and that was very powerful. So thank you for that. I would like to first of all ask specific questions for each of the panelists. So, Dr. Yaqub, your work sits at the intersection of emergency medicine, AI innovation, and medical education. So, could you share what initially inspired your interest in integrating AI into clinical practice, and basically how that journey has shaped your approach to improving diagnostics, predictive care, and empowering your fellow healthcare professionals?
Okay, so actually I started to look for this artificial intelligence thing, but it was introduced to me by one of my students actually, and by going over the corridor, she just stopped near me and said that like you know about ChatGPT. I was just totally blind. I went to Google, and then I started to explore. It was back just in 2023. Then, apart from them, there's some scientific researchers, basically academic researchers like Mushtaq Bilal, Razia Leani. She's a public health expert. I started to follow them, and definitely it has by incorporating, mostly I incorporated artificial intelligence in my scientific research work, in the way I communicate with the people. And also, like I worked on a project where we use telemedicine to predict the pain outcomes, severity of a patient with low backache. So it was a broad project by by a UK-based firm. So definitely, artificial intelligence has made the work of a doctor more intricate, more predictive, but only if you maintain your critical insight. If you maintain the critical thinking job of a physician or any healthcare provider, it can ease a bit more. The clinical horizons can be widened. The healthcare outcomes can be predicted more precisely, more accurately, rather than the pre-AI era, if you think. Still, I think apart from other panelists, I'm not more into digital transformation, but still, for my medical education journey, I prepared a chatbot specifically, like when I was preparing for my MRCAM OSCE exam. I prepared a chatbot. I circulated it with some of the fellow colleagues. Some appreciated, some not. What we did, basically, what I did whatever the available materials. I trained the chatbot on that. Then I embedded its knowledge base with specific books. What was the examining criteria? Then ChatGPT when it for audio visual. Mostly communication stations, the teaching stations which come in the clinical exams or OSCE exam. I practiced with ChatGPT, and I think it was more of fun based learning and more accurate rather than practicing with any human being. This is seriously I can say. So AI has a lot role in healthcare research, medical education, clinical decision making is one set, but clinical decision making a lot has to do on ethical research framework before putting AI in clinical decision making. This is all I have to
Thank you so much.
say about it.
Thank you so much. That was very insightful. Dr. Mohammed Assaid, so throughout your extensive career as the head of the digital health transformation and training in research in the Nasser City Cancer Center, could you share with us what initially drew you to this field, and how do you see AI playing a role in advancing the work that you've done?
Regarding AI application in oncology, oncology is data-driven domain involving multiple specialties to help cancer patient survival. We have in Egypt initiative for breast cancer screening using mammography, and the application of AI are present as a pilot initiative regarding detection of cancer lesions, breast cancer lesions in mammography films and views. However, this is a pilot initiative in not all cancer centers in Egypt. And there is a challenges for application regarding trustability of diagnostic radiologist in the result, and taking fear of taking their places in assessment of mammography in detection of breast cancer lesions. Regarding there is a challenges in Egypt regarding learning of clinicians about AI, how to help them in diagnostics and the treatment journey of patient. This is can be solved by foundations of AI and digitalization at medical schools. Still, there is a gap in undergrad regarding foundations of digital platforms and digital education at medical schools, but there is a postgraduate studies from diploma, master, and fellowship Egyptian board in health informatics. I think there is a solo digitalization regarding electronic medical records and electronic health records are present in Egypt, but in Asulu hospitals, not integrative environment. Also, especially in oncology, as oncology is require a pre-planned digitalization in electronic medical record. We assisted in design of electronic medical record for oncology, onco EMR, but at the level of designing is not launching, not yet launched. And as mentioned from previous speakers, the most application of AI are present in radiology. As radiology, the diagnostic images are digital by default, and application of AI require digital data. And digital data in imaging is well established through PACS system. However, data from electronic medical records require the integrative and the big data to inform and design retrieval from this data to aid the diagnostic and treatment therapist for patient. And this is my insights from this application in Egypt from AI perspective. Also, I wish to add some points for enhancing the implementation of AI. AI mainly targeted for CS, computer science specialist, not for healthcare professionals, and this is a gap between computer science specialists and clinicians. Different language between them. And this is the place of healthcare informatics and clinical informatics, mainly in Western countries. Regarding in Egypt, there is initiatives by Ministry of Telecommunication for implementation and awareness about digital solutions. Some clinicians and healthcare specialists, physicians, pharmacists, nurses are joining these specialties, these initiatives, but at a small number, not a huge number, especially for early career specialists. As the initiative, the application of AI in third world and developing countries should start from education, especially in medical and healthcare schools. Thank you for your attention.
Sorry, we seem to have a bit of disconnectivity with Dr. Razan. I'd like to step in and continue with the questions. The next question will be for Mr. Alwyn. With your experience leading to InstaPract, how do you envision health tech solutions transforming access to primary healthcare in, say, underserved communities, especially in countries with limited digital infrastructure?
Thank you. That's a good question. Thanks for bringing it up. What I've seen or what we have implemented is countries which has this. There are two major requirements which is very much required when it comes to implementing a full-fledged digital healthcare solutions in a successful rate. So one is you need a common thing, which is the digital public infrastructure. So this is like, for example, in India, we have Aadhaar. In UAE, where we operate, we have Emirates ID or something where the user or the public's information is being stored and you have a digital system to go check and do all those things. Okay, that's a digital public infrastructure. And the other part of the infrastructure is about the connectivity, the speed, then the availability of the doctors, availability of the services to be provided, if there's a diagnostic service to be performed, or to a pharmacy to be dispensing some medication and all those things. So there are two major infrastructures I would be focusing on. So we have worked in countries where both of these have been in peak, and in few places where we have worked, where we know that both of them are not in a great existence, and things like that. So the first part of digital public infrastructure. So if you have something, and I think most of the countries today, including small countries, are trying to build this digital public infrastructure, which will make you to have one proper medical record across the system, so that the patient's health record and the continuum of health can be continued across digital providers as you keep moving, and which is good. If we don't have that, we have to live with it. So you define your process, which will allow you to onboard these patients, provide them the care, and make sure that you don't have redundancy of data and all those things, which is a different part of the story altogether. But in cases where you don't have infrastructures like internet or not much of doctors available, you don't have if you have to do a diagnosis, you need to do a test, then you need to travel some few kilometers to do that, 10 kilometers, 20 kilometers. So in these kind of areas, how we have done is we have packaged our telehealth solution to be part of in a small box, which can be carried by a healthcare worker or a community worker who goes down to this place, stays there for a few hours or a day or a week, based on the need, and then they perform all these things. And this is not just telehealth and some devices, right? So we also provide them with integrated point of care solutions. So with strip-based tests, we try to get understanding about checking their infectious disease part, getting their glucose level tested for various diseases and disorders and things like that. So it's a pretty different system. So basically, what you need to do is you package the entire clinic and send it to the patient's home, so that they can be or to their community, so that you can provide them the care which is required to get them to the right track. So technically, yes. Uh, that is a different model which has been done. Not every digital health provider is capable of that. There are very few providers who work on this kind of a model, and we do have some good experience around on that use case.
Thank you so much for that. I apologize, I had some connection problems, but I'm back. So I would like to pose a question for all of the panel. So as you know, the key topic of this discussion today is equity. So as you know, AI has potential, as we know, to transform healthcare. But how can we ensure that it does not exacerbate existing disparities in healthcare communities? So how do we ensure that AI-driven solutions are accessible and beneficial to the underserved communities? And what specific measures do you believe can be taken to avoid deepening the divide in healthcare communities?
So if I can take that question first, Bhavan, the thing what we have seen is the largest equity issues raises when because there's no same kind of care being provided for a patient who's living in tier one cities versus person who's sitting in a remote place where they don't have the same kind of a doctor, the same kind of a environment or the tools technically been available. So that's a larger disparity and the larger kind of equity issues what I am exposed to in large cases. Apart from the financial part of it, because there are insurances which comes into play in certain part of the world. Maybe your top tier insurances covers top tier hospitals, and that's a different part of the equity again, but in a very generalized form, what we see and what we have seen is a patient even staying at the remote place should be able to access the care what a tier one city can do, and today technology is enabling that and providing it in a good form factors at this point of time. But when it comes to these digital tools being affordable for these healthcare providers to be used in even in tier 2 tier 3 cities or in villages, that's where the entire question comes into play, because it's not that the doctors, right, it's not the care which is being provided, it's the tools and how it is getting worked out. So there are governments working on these things and in larger things. There are the funding bodies, right from the UN funds to lot of these public funds which is being made available to make sure that there is no disparity around it. But still, this is a very broad spectrum, broad area, not that we would be able to address it from day one, but definitely going digital is helping us out there to get this today. But again, it doesn't mean that AI is solving everything by itself. It needs the right provider on the other end so that it can be driven to the right level. So with that as a note, I close my remarks, but open to understand from my peer members here.
Thank you so much for that.
Okay.
Would any of the other panelists like to add?
Yes. Regarding ensuring accessibility and equity for AI data-driven solutions, first of all, digital infrastructure investment, as internet access required for most AI, especially AI platforms or online applications. From my perspective, in AI application in mammography, it is online, not offline platform, and this may not accessible to all regions, as internet access not available to all regions, especially in rural areas. Also, AI applications are mainly built on data from Western population, especially in oncology. Genetics play a major role in incidence of cancers. Therefore, training models on diverse and representative datasets to avoid biases. And this requires the first requirement of digital transformation and big data storage, especially for imaging. Regarding to solve the problem of online applications, it may solve it by offline affordable tools. Also, to be the models should be or required to be open source, as the black box dilemma make a challenge for ensuring the clinicians about what going inside the AI tools. They especially insist to understand what is going and inside the AI tool to provide the decision. And this required for community co-design and the testing of AI tools before implementation to address real need and the culturally relevant needs of AI tools, especially for local areas and country-specific areas not producing the AI tool. And thank you.
Thank you so much for your point. You made a very great point about the fact that a lot of the data sets that we have are based on Western populations. So there's a need to diversify and improve all of our data sets for AI to learn from so that it would be more inclusive. So thank you so much for that great point. Is there anyone who wants to engage with anything further?
Okay, I just want to briefly have my point on equity. Basically, this is a very important point the panelists raised, that most of us, we have a data from the Western population. We don't have data from, so the need of our is to develop such AI integrative activities in middle, low and middle income countries. So we can, once we have access to data, then we can further train the models and we can develop models on the basis of cultural ethnic sensitivities. So this is one need of ours. Then second responsibility comes on the people that belong to low and middle income country. Now this is very important. Why I'm saying that on my experience, low and middle income country people are not using artificial intelligence in the right way. Okay. The rising trend 2 weeks back, Ghibli images, most of it was generated from low and middle income countries. It was not much generated from high income countries because they don't have time. We have surplus time, I think, low and middle income countries. So the need of ours is more responsibility on us. Then second thing is artificial intelligence can be incorporated in research curriculum, universities curriculum, and the most to teach about its ethical aspects, because there is a lot of negativity you can create. Our internet is being flooded with the negativity of the use of artificial intelligence, creating fake images, fake citations. So this is main thing, that to educate. Once you educate, then train, and then refine your models in low and middle income countries.
Thank you so much for your point. You raised a very important point, and basically what our next question is going to be about ethics. So we're going to be launching some polls, and we would like everyone to interact with these polls. One of our volunteers is going to put up a poll. Please do interact with it. All right, so as the poll is running, we're going to be posing the next question to our panelists. Please try to answer, and so that we have, at the end of our question, we have everyone's answer. So for our next question is the ethical consideration. So AI is usually often criticized for potential biases in its algorithms, and which can negatively impact a lot of the vulnerable populations. What are some of the ethical challenges that you've encountered, or maybe you predict to be encountering in your work with AI in healthcare? And how do you believe we can address these issues and ensure fairness and equity in the outcomes?
Regarding ethics dilemma of AI tools, first of all, informed consent and data privacy. As for my example, in application of AI in detection of breast cancer using mammography, the mammographic images are uploaded on servers, online server, not local server, and the data privacy is a big issue. The tool, mainly mammography films are containing the names of patients on the film itself, and this require data privacy and informed consent from the patient to agree with using this tool before implementation. However, most patients not fully understand AI tools. Also, the black box dilemma of the algorithm inside the AI tools. It may be hard for physicians and clinicians and the patient to understand, and this require brief data and in-depth data literacy for clinicians to understand how AI tool is working. Also, the bias, as we discussed in the previous question about the bias in data and algorithm. Almost all AI tools are built on data from Western population, and this may be introduce a bias in interpretation and application of AI in Eastern and Middle East data due to genetics difference. Thank you.
Thank you so much for your point. You raised a very important message. So thank you so much for that. Does anyone of the other panelists have any additions to that or any more opinions?
I just want to add on this. There are a lot of practical challenges. One is the doctor just explained data privacy, and then is your accountability, responsibility, and human oversight. So for all these, again, my emphasis will be on proper research framework, tight regulatory frameworks to overcome, because there may be a bias the way the data has been built or the complexity of the data that has been provided to build that AI chatbot. So these ethical concerns, data security, then maintaining your critical insight or critical thinking while employing these AI tools in real world practice. These must be kept into mind, and regulatory frameworks must be employed to it. I have seen people, because a lot of people who are in digital transformation, they are they're not strictly adhering to the HIPAA guidelines, but these regulatory framework must be in place. So data privacy, security, and proper accountability, because currently there are no laws for these chatbots. So regulatory framework must be employed, and this must be done on country-based level, regional level as well. So this is my point on that.
Thank you so much for that.
Just to add, just to add to what my fellow panelists were talking about. So the pretty much openly available framework or act today is with the EU AI Act. So it's not going to be relevant everywhere or in every part of the world, but at least something as a policy, what we see today is the European Union's AI Act, and adhering to most of it is gonna take care of certain things, especially the ethical part of it is going to be taken care. And when it comes to the patient's information and other pieces, adhering to the GDPR kind of equivalent standards in that particular country would make more of a sense. So we operate in UAE, and we have equivalent to GDPR here in UAE. and very soon we're going to have policies similar to the EU AI Act, where it's not just a guidance, but also it comes up along with the framework on how you get through that process. So I think at least for healthcare, if we start using to do that, that's going to be helpful. But it is not just for healthcare, right? So any AI, it has to be responsible enough to handle information and also work in an ethical way, so that it's not gonna discriminate people. It's not gonna make the data or take any kind of an issue which can cause the patient's privacy to be put in problems or anything around the ethical side of it.
Thank you so much for that. That was a great point. Before we conclude, I would like to open the floor for any questions. If anyone wants to ask any questions to our panelists, please open your mic and ask. Or if you are not able to open your mic, you can write in the question bar and I will read them for you. All right, there is a question from Dr.
Yes,
Ali,
sir.
for Dr. Rehan Yaqub. Can you please suggest reliable, trustworthy AI tools, mobile app compatible with Android for monitoring post-operative patients for surgical site infection?
Okay, so thank you very much, Dr. Shafqat, for this question. Currently, I don't think so. There is a reliable app or a tool specifically for the surgical site infection. But yes, we can deploy chatbots on our need according to our regional wise policies pertaining to surgical site infection. In this perspective, most of the research I have seen that Google DeepMind, this is an AI powered tool which can be integrated for such kind of precision or you can say an accuracy for the surgical site infection. But currently, I don't think so. There is any one reliable tool for surgical site infection.
Thank you so much for your answer. If anyone else has any further questions, please do write them in the message, or you can open your mic and engage immediately with our panelists. All right, if no one has any further questions, I would like to ask our panelists to please open their cameras if possible, so we can take a little photo so that we're able to commemorate this really fruitful discussion. Thank you so much again. Thank you. All right. Again, this was an amazing discussion, and there is
Hello.
a wonderful, basically, application to all of the words that you guys said. I think it can inspire people in the future, and a lot of our discussion was basically something that can engage people and open the floor for further discussion in the future, so that basically we can advance this topic. Thank you so much again. I will give the floor to our volunteer so we can transition to the next parts of our session.
Thank you so much for that insightful panel discussion. We'll now move on to the interactive networking breakout session. So if the breakout sessions could be set up, that would be really helpful. So we'll actually be going over the lightning talks right now. Let me introduce the lightning talks round to all of the members present over here. So this will consist of short 3 to 5 minute talks, like relating to artificial intelligence topics and drone-based medicine delivery. I will hand over the floor to the lightning talk discussion. Thank you. I would like to hand over the floor to Dr. Fatima so that she can guide us through this session of the webinar.
Okay, so hello everyone. I hope you're doing well, and thank you so much for inviting me to share my experience. So my name is Fatima Al-Basri. I am a recently graduated doctor. I originally come from Sudan, and I'm currently based in UAE. So during this session, I'm going to give you a brief background about my advocacy action in digital health when I was a medical student and the work that I was doing globally. And by the end, I will really appreciate if you have any sort of questions or concerns. I will be so glad to address them. So speaking about myself, I am a recently graduated doctor and youth advocate who led numerous initiatives at the intersection of digital health, youth empowerment, and global health. I have held many positions and worked in many policy and advocacy leadership activities. For example, I was acting as External Affairs Regional Assistant for the African region in the International Federation of Medical Students Association, which is a leading youth organization with more than 130 countries as members of the organization, which is representing 1.3 million young people worldwide. So as the Regional External Affairs Assistant in the IFMSA, I worked with the WHO Regional Office and some regional partners like Africa CDC and the African Union to bring some specific regional priorities into discussion. For example, last time our priorities was mainly the digital transformation of health system in addition to SRHR education. So I also had the chance to speak during some of the UNGA side events about digital health and youth mental health. I also contributed to IFMSA Digital Health Policy Campaign and organized workshops about digital health and youth-led digital health transformation. Those workshops included African medical students from different African countries, as well as coordinating WHO simulations on the WHO Regional Committee meeting with the medical students on digital health during IFMSA global meeting. I also worked as a co-organizer and moderator of side events in other high-level meetings of like United Nations and World Health Assembly as part of IFMSA delegation to the 74th World Health Assembly. And my experience as a youth delegate was really enormous as I had the chance to draft specific statements about some agenda that included different global health topics like climate change and digital health as well. I'm also acting as a research since I was a medical student supported by my colleagues and mentors, and I was able to publish more than 10 papers when I was a student. And now I'm working in the digital health field. For instance, during the previous year, I conducted a research on the medical students' knowledge and attitude toward digital health in Sudan. And I also worked with Speak Up Africa, which is a regional organization that we have in Africa advocating mainly for gender justice and digital health on a commentary and article perspectives about the African women leadership and digital health. Alongside this, I'm actively mentoring and capacitating medical students and some early career health professionals to conduct impactful research on digital health, medical education, and other topics which are related to public health as well. So my journey has taught me that peer-to-peer capacity building and bold advocacy and seeking mentorship are essential in driving meaningful change. So whether you are starting out or already active in this space of advocacy, remember that your voice matters and your work is really validated. And together we can shape a more equitable opportunities for youth to be engaged in a meaningful way, either in global health space or digital health. So that was a very brief introduction about the work that I'm doing and I was doing as a medical student. And I know that some of you might be starting in their advocacy journey, either as students or early healthcare professionals. So I'm ready to answer your questions or address your concerns in case you have any. Thank you so much.
Thank you so much for that, Dr. Fatima. The questions will be discussed during as they come. I will hand over the floor to Dr. Darina.
Hello, everyone. Can you hear me?
Yes, you're audible.
Okay, thank you for your introduction. I would like to quickly clarify I am not a doctor, at least not yet. My background is in public health. Apologies for having to keep my camera off today, but regardless, I'm glad to share my view on today's topic of discussion with you and a little bit of my personal experience. So my name is Darina Uram, and I graduated from a research university in Maastricht, the Netherlands. What led me to my degree is precisely the health inequity that I have been observing in my home country, with large gaps in access to healthcare for people from different socioeconomic backgrounds in urban versus rural areas. For example, in the area of Romania that I come from, only 7% of the population lives 15 minutes or less by car from a healthcare facility, and overall Romania is at the bottom of the list of access in the EU, not to mention the cost of care in rapport with average income. While I have not had the privilege to take part in a project targeting this issue so far, I'm actively looking for opportunities to contribute to projects that promote health equity, especially through technological innovation, where I see more and more potential. During my studies, telemedicine and its benefits were frequently discussed as a way to increase access to healthcare. This was especially the case because I studied during and after the pandemic. The health issues that came up in discussion were often related to physical health, but the area that especially captured my interest is the use of AI to support mental health, particularly for marginalized populations who often face systemic barriers to care. This is because I noticed in my environment that mental health was not seen as a priority next to physical health, although the situation is slightly improving within the younger generations. It's clear that online mental health services have already improved access and helped raise awareness. Many platforms now allow individuals to connect with therapists remotely, which is a significant step forward. However, these services still depend on real-time access to trained professionals, which can be costly and difficult for many people to afford or schedule, especially those living in underserved areas. Now let me tell you about the shift I wish to see in access to quality mental health support, where I believe that AI can play an important role. I envision a tool, perhaps an app or a website, that provides accessible, affordable, and confidential mental health assistance to anyone with an internet connection. Such a platform could be available 24/7, lowering the barriers posed by cost, stigma, or limited availability of human specialists. For example, this AI-driven support system could be designed to prompt users regularly with simple, empathetic questions to track mood and emotional well-being over time, to recognize signs of mental distress and respond with personalized evidence-based advice and coping techniques, to offer immediate support during moments of crisis such as anxiety or panic attacks, to automatically alert emergency services or connect users to suicide prevention hotlines in urgent situations, to compile relevant resources and guide users towards appropriate professional help, eliminating the confusion that can follow the realization that help is needed. And importantly, this technology would not replace mental health professionals, but instead act as an accessible first line of support, filling the gaps where human help is unavailable and efficiently guiding users towards long-term solutions. This is my vision of how AI can be empowering in advancing mental health equity by making available a service that guides and educates free of charge. And I'm looking forward to this becoming reality. Thank you for giving me the floor. And I am welcoming any comments, criticism, questions. This is just an idea that I have, not a plan of action per se. But yes, just thank you for allowing me to share with you what I am passionate about in this area of public health.
Am I audible? So I would like to hand over the floor to Dr. Navya if she's available. And before that, I would also like to thank Ms. Tarina for her very enlightening talk. Is Dr. Navya present in this meeting right now? I think she is not, in which case we would like to conclude this meeting here. Please do check the WhatsApp group for the links to join the breakout rooms. Also, we will be sending the link for the resource document, which will help you find a lot of the information that we have compiled together and will make it easy to access for you. Also, there will be a feedback form that will be sent in the group. Please do fill it out because it helps us understand where we have to improve and where we could possibly make the sessions even more interesting. So yeah, I see that the link has been sent in the chat for the resource document. Do take your time to go through it. Also check the WhatsApp group for more updates on the breakout rooms. Thank you, everyone. We loved having you here.
Thank you, guys.
Thank you.